We have been doing our due diligence, we have been complying, and we've been quarantining really well, and that shows in our numbers. Important thing about the numbers that you see every day as a coronavirus updates, all these apps, not only pay attention to how many people got infected, but most importantly, and more I would say importantly, pay attention on the number of people who have recovered and number of deaths. Of course, that's an important number as well. To me, it reflects more where we are in time. Here's a really interesting article by NPR featuring Dr. Corey Kasper Institute in Seattle, known as Infectious Disease Institute, University of Washington. They're launching COVID-19 immunotherapy trial, and they're focusing on immune system of really sick patients. They're trying to figure out the ways for early immune system response to this COVID-19 pandemic, so that our immune system is really quickly responding and somehow boosting that immune system. So basically, what that means is you need to take care of your immune system. You need to make sure it's working really good right now. The research going to be focusing on these killer cells in our immune system. This is early immune system cells called monocytes. And the way that we could boost our monocyte count with number of different therapies, including hot and cold therapy, Wim Hof method, including a lot of sleep, supplement and diet, and so forth. So this is further reinforcing the idea that we need to have really good immune system right now. So please be aware of that. Another highlight is the ultrasound research in COVID-19. Very interesting subject right now. For right now, when patients come in to emergency room to be admitted at the hospital, they're suspected to be positive with COVID-19. They'll undergo a chest x-ray, and most likely a CAT scan of their lungs would be examined by radiologists. However, this method is proven to be kind of slow because after every patient we have to really carefully wipe down the surfaces so that the next patient won't contract. So this slows us down 45 minutes per one exam, which is kind of a slow, and it reduces number of CAT scans that we can see. So the newest way they're starting to examine patients' lungs is through ultrasound, and that's been done in New York. It has been done here in Washington State and in California. So what they're looking at is they're looking at the ultrasound, and radiologists actually adapting their eye to be able to diagnose certain patterns of COVID-19 virus through the ultrasound images. Very interesting. It makes ultrasound versus CAT scan really fast. And also, ultrasound is a portable medium, so you could potentially take that to patients' rooms and do it really quickly. And so there's a lot of articles about that. Those of you who are interested, please look that up. Really quickly, updates about testing. Rapid testing is implemented. However, it is being reserved for only really sick. Rapid testing usually takes about 40 minutes, but those are for inpatients only. If you are going to be tested at the hospital with drive-through through the garage or through one of those portable tents, you're gonna still receive results within 12 to 15 hours. So if you go there in the morning, you can expect results during the evening time. Sometimes you will receive a phone call or email, or maybe next morning. I think we're experiencing shift in our mentality When I look around, I see a lot of people beginning to accept the reality of things, beginning to stabilize emotionally. I see less fear in people's eyes, less confusion, and more sort of the attitude, okay, what's the next step? What do we need to do next? Tips on how to stay safer, how to be more efficient fighters during this pandemic. Um, Washing your fruits and vegetables is super important topic. I would like to bring it to your attention. Before this pandemic, it was okay for us to rinse fruits and vegetables in a container, kind of rinse it with cold water. That's fine. Now you have to make sure that you rinse it in warm, soapy water, and especially the fruits and vegetables that you're not going to cook, that you're gonna eat raw or gonna chop into your salad. You're going to have to wash it with soapy water and rinse it really well. Yes, that some people might have a problem with, saying that this is going to be soapy taste on my apples or in my lettuce. I don't want that soap. But as of right now, it's the best line of defense. So fill your sink with warm soapy water. You don't have to use a lot of soap, but a reasonable amount of dishwasher soap, liquid soap. Mix it up really well and put all of your fruits and vegetables. Especially pay attention to things like broccoli, where you can't wash it. The surface of the broccoli is really porous. So submerge it completely, soak it in the warm soapy water. Another thing that I would like to bring your attention is how safe are we driving right now? What are driving habits? This morning, as I was driving to work on I-5, I saw several cars just bucking it 85, 90 miles per hour. There's no traffic, so they're just like going for it. It is really critical that you bring it to your attention and to your family members' attention how dangerous right now for you to end up in the hospital. If you even have a mild car accident, you will end up in the hospital with broken limb, but you may contract coronavirus inadvertently being in that hospital. You're putting yourself and others at risk. So please adjust your driving styles. Everyone needs to be more and more careful when not only being at home, but when being outside as well. So no car accidents, please. Please be as careful driving as you possibly can. Deliver this message to your teenagers who are driving now. Deliver this message to your friends, family. Just send them email and say, please, for the next month, every time you get in the car, you're going to tell yourself, I'm not going to have an accident and I'm not going to go to the hospital and catch coronavirus. That's all you have to say to yourself, and then automatically you're going to drive safer. The important topic to talk about right now is supporting local businesses, and especially small businesses. Yes, federal government created stimulus for small businesses, but this is not going to be enough, and we really need to come together as a community and support the really small businesses. The way that you can support small businesses is either by just direct donation to them or maybe ordering something from them. Just order something really small. That helps. That really helps. Continue to focus on every day, what we do every day, day by day, and not look into the future too much. That will help us to be much more stable, and that will help us to make right decisions. So until another update, please take care and be safe.